Welkom hierso by ons openbare lesing vanaand. Dit is regtig lekker om julle almal hierso te hê. Nou ons maak so iets van geskiedenis hierso vanaand met dit dat vanaand se openbare lesing is die eerste openbare lesing wat vanuit Akademia se NP van Wyk Louw-sentrum uitgereël is. Nou dit bring miskien die volgende vraag na vore, wat is die NP van Wyk Louw-sentrum? En ek gaan baie doelbewus die antwoord op die vraag baie kort hou, want die rede hiervoor is op die 25ste Mei, ook hierso in die auditorium, het ons NP van Wyk Louw bekendstellingsaand en dan gaan die hele aand gaan min of meer vir jou die vraag beantwoord. So ek wil julle eintlik terselfdertyd daarna toe uitnooi. Dis die 25ste Mei ook hierso in die auditorium. Maar in kort kan ek net miskien dit sê. Die NP van Wyk Louw-sentrum is Akademia se denkforum. En as 'n denkforum, is dit 'n denkforum wat verbind is tot die najaag, die soeke en ook die geleidelike ontdekking van alles wat waar is, alles wat goed is en alles wat skoon is. En so is die denkforum dan verbind tot hierdie soeke na die werklikheid. En deel van hierdie maak dit natuurlik ook 'n groot verantwoordelikheid van die NP van Wyk Louw-sentrum om openbare geleenthede soos vanaand ook te reël, want deel van hierdie soeke na die werklikheid word natuurlik bemiddel deur aande soos vanaand, waar ons 'n openbare lesing het, so bymekaar kan wees, uitgedaag word, maar ook verryk word, en saam ook kan gesels en dink. So op daai noot wil ek julle almal uitnooi, as julle enige vrae het, kan julle na die tyd vir professor Reitze Rodseth ook julle vrae vra. Nou, professor Reitze Rodseth is Engels, en dit beteken sy lesing gaan in Engels wees, maar natuurlik as jy sukkel om jou vraag in Engels uit te druk, vra asseblief jou vraag in Afrikaans. Hy verstaan daarom so bietjie Afrikaans, en as dit nog nie heeltemal by hom uitkom nie, sal ek seker maak, dit kom op een of ander manier by hom uit, dat hy dit wel vir jou kan antwoord. So asseblief, na die tyd gaan daar geleentheid wees vir vrae en antwoorde, maar wag asseblief dat die mikrofoon by jou uitkom, voor jy jou vraag vra, aangesien ons ook vanaand opneem. En as jy jou vraag vra voor jy die mikrofoon het, gaan jou vraag nie opgeneem word nie. So dis so iets van vanaand, net so vinnige antwoord op wat die NP van Wyk Louw-sentrum is. En dit beteken natuurlik openbare lesing soos vanaand, openbare gesprek, openbare dialoogvoering gaan 'n groot verantwoordelikheid van die sentrum wees. Maar soos ek sê, ek nooi julle dan uit om verder te hoor hieroor later hierdie maand. Nou, ek wil net so vinnig Reitze se CV aan julle voorhou. Reitze Rodseth is 'n narkotiseur en kritiekesorgspesialis wat in privaat praktyk in Pietermaritzburg werk. Hy is 'n kliniese navorser met 'n wye verskeidenheid belangstellings. Sy navorsing oor perioperatiewe risikostratifikasie het gefokus op die rol van 'n hormoon genaamd BNP in die voorspelling van hartaanvalle na 'n operasie. Hierdie werk het gelei tot 'n PhD van die Universiteit van KwaZulu-Natal. Hy het 'n groot belangstelling in hoe navorsing gedoen word en die gehalte van gepubliseerde navorsing. Hy het 'n meestersgraad in gesondheidsnavorsingsmetodologie aan die McMaster-Universiteit in Kanada verwerf en lewer aanbiedings oor etiek en bedrog in kliniese navorsing. Hy het meer as 120 ewe knie geëvalueerde referate gepubliseer, waarvan 30% op navorsingsoorsig en gehalte-ontleding gefokus het. Hy het die UKZN-visekanseliersnavorsingstoekenning en 'n Suid-Afrikaanse nasionale Navorsingstigting-gradering ontvang. Hy is getroud met Miranda en het 2 seuns, Joshua en Nathan. Nou, ek het Reitze ontmoet in 2017. Ek dink dit was 2017, maar die geleentheid was die volgende. Ek en 2 vriende het by sy huis opgedaag vir bedieningswerk met die sogenaamde Ratio Christi bediening. En ons het nou die heel pad gery Pietermaritzburg toe, so ons was laterig in die aand daar aangekom, en Reitze het die deur vir ons oopgemaak, en toe het hy ons weer verlaat, so half in die voorportaal van sy huis, en verdwyn, en toe moes ons nou 'n bietjie daar wag, en rond staan, en ons het grappies begin maak en nogal redelik hard begin lag uit die aard van die saak en Reitze het weer om die hoek verskyn, redelik kwaad, geïrriteerd en gesê, hoorie, hier is mense in my sitkamer wat vir die eerste keer in hulle lewe probeer bid. Hulle het tot bekering gekom en hy probeer 'n atmosfeer skep waar hulle regtig kan bid as Christene en ons is besig om dit eintlik nie 'n goeie werk, nie om regtig te help om hierdie atmosfeer te skep nie. En dit was toe ek Reitze die eerste keer ontmoet het en van daar af het Reitze natuurlik homself baie diep ook in vanaand se tema ingegrawe oor die jare. Hy het op 'n call vir my gesê die hele tema rondom geslagsidentiteit en sy navorsing op hierdie veld was nie iets wat hy gekies het nie. Dit was so iets wat hy nie langer kon vermy nie, weens die relevantie daarvan in ons tyd, die vraagstukke, die kwessies daar rondom. En so was hy geforseerd in 'n sekere sin om in hierdie tema in te duik en te begin met navorsing daarop. En so Reitze, van Akademia se kant af, baie dankie vir jou tyd, ek weet jy's 'n besige man. En ja, ons sien regtig uit om na jou te luister op hierdie relevante onderwerp. En ja, dan gee ek graag aan jou oor. Dankie hoor.
Ek is jammer as ek bietjie kwaai was, Daniel. My naam is Reitze. Afrikaans is die taal van liefde vir my. Ek is Engels groot geword, my ouers sit eintlik hier agter. Maar ek is Tuks toe, ek het Afrikaans daar bemeester in die najaag van my vrou Miranda. Ek en sy praat Afrikaans by die huis, maar as dit kom by van die tegniese mediese terme, dan raak dinge 'n bietjie de mekaar. Dis die eerste keer wat ek my CV so mooi uitgeleef word oor in Afrikaans. So as jy 'n vraag wil vra in Afrikaans, voel vry om dit te doen. Ek sal meeste van dit kan antwoord, maar as dit by die tegniese goeters kom, dan slaan ons maar oor in die Engels in. Okay, so I'm going to be speaking on the issue of gender identity. A metaphysical and scientific approach is going to be a bit of a meandering because it touches on a lot of points, a lot of different concepts, and hopefully it will paint a picture that will allow you to think more clearly about this whole process. Just a little bit about me. This is my family, Miranda, my two boys, Josh and Nathan. This is the photo that you put on the Christmas card. Jy weet as jy nou vir die familie wil stuur. Dis eintlik hoe dit lyk meeste van die tyd daar by ons. Bietjie crazy. Net my agtergrond, soos Daniel vir julle gewys het, ek is 'n mediese spesialis, 'n ICU intensivist, maar ek het 'n groot belangstelling in navorsing en die kwaliteit van navorsing. Hoe weet ons wat ons doen? Hoe weet ons wat ons dink ons weet? Hoeveel vertroue kan ons daarin sit? Ek is ook op die oomblik besig met 'n meesters in filosofie en Christian apologetics. When I speak about the issue of gender, I speak from my position as an evaluator of the quality of research, not as a psychiatrist, not as somebody who is involved in the treatment of management of gender identity problems. I'm associated with Reitze Christie, en ek dink dis 'n chapter hierso by julle. Ek sê julle aanmoedig om betrokke te raak. Ek is lid van die Society of Evidence-Based Gender Medicine. It's an international association, and also of the Wilberforce Academy. My disclaimer, I'm not a psychiatrist or child psychiatrist. I do not have experience in treating persons with gender dysphoria, nor do I treat persons with gender dysphoria. This presentation is not clinical advice, and I speak in my capacity as a member of the Wilberforce Academy and the Reitze Christie, and not as a representative of any other organization, and I speak as a medical expert in the analysis of research quality. And the extent of my disclaimer, I think, is a reflection of the times that we live in, unfortunately. So, I'm going to start off with this question of identity and ask the question, who am I? Maybe one of the most perennial questions that get asked at the center of every person's question of, who am I as you're starting to grow up. A definition of identity is a person's sense of self. It provides sameness and continuity over time, and it's established by the unique characteristics, affiliations, and social roles. But the key word in this is a person. What is this person? The what that I am in many ways precedes the who that I am. And when you talk about this question, you have to start off by asking the question, what is this person? What is a human being? It becomes the focus point and the center point of discussing this whole process. My understanding, a human being is a creature, that which has been created. And I think there's good evidence to suggest that there is a God. My understanding of humankind is a merging or a meshing together, a oneness of both matter and spirit. I don't see humans as being a spirit that is in matter. We are in a oneness of those two. The technical term for that is holomorphism. We are created in the image of God, that which has intrinsic value. You don't need to do something to be valuable. You are valuable. And humankind is intrinsically relational as well. Those four concepts, and I think that reflects the relationship in the Trinity, that is for me the understanding, a clear understanding of what humanity is. An important part of this as it relates to the concept of gender is that we are not born into a body, we are our bodies. There's this dichotomy, this split in culture and understanding as though you receive this body. But I think that's a faulty way of understanding reality. You are your body. It's not something that you, like a meat machine that you put on. You are both body and spirit. It's very interesting for me, in medicine, we've gone a long way into drilling down into the physiology and the anatomy and becoming very technical, the genetics, but there's been a push in medicine to step back and to say, you can't treat a person as just a heart problem or a kidney problem. When you treat a person, you treat them as a dynamic whole, understanding them as a full entity. The part of the research that we look at this is called systems research, biological systems research. And there's a big push on holistic medicine, not airy-fairy stuff, but understanding the person as an integrated whole. And so in the system of medicine, there's an understanding that true health is about dealing with a person not just as a body, but as an integrated whole, which I found very interesting when we look at it from this framework. So the what is the foundation for the who. Wat is jy voordat jy wil weet wie jy is? And in English, when you talk about the who, I don't know if you guys know this band at all. It's the Who. You don't see anything. How's it? And interesting enough, this band's album was called Don't Know Myself. Anyway, identity. So it's a person's sense of self. The person is the key at the center point of this. Provides sameness and continuity over time. It is unique, and it is built up by characteristics, affiliations, and social roles. A big understanding of identity today in our modern world is that dignity, pride, and honor are linked to that identity. And those are implicitly linked to social characteristics or social categories. Those categories inform and for many people give them worth in their identity. In a Christian identity, classically, we are created in the image of God, and therein lies our value as a created being. That's part of that component. And in a New Testament understanding in Jesus Christ, anyone who is in Christ is a new creation. So you have an understanding as a created being and then as a recreated being in many ways. Now, Os Guinness says that contrast is the mother of clarity. It's how you understand something. In my understanding or my analysis of what's happening around this transgender issue, and in many ways the cultural zeitgeist of our times, what is the answer to what am I? What are we? What is a human being for the average person today? If you start talking to people, there's a conception that we are a soul or a spirit, and we walk around in this meat machine. There's a divine spark or a piece of God within us, and in many ways it's trapped in this human flesh. We understand or get freedom from this trappedness through obtaining knowledge, through understanding who we really are. You can throw off your flesh, you can change that which you're trapped in, and doing that you receive freedom or true expression of the true person that you are. It almost sounds like a new religion. But in many ways, it is an old religion. At its core, this is called Gnosticism. Those that you're aware of the concept. So there's nothing new under the sun. This is almost like a returning back to this. The concept that we are becoming progressively more atheistic, I think, has been shown to not be true. Man is in nature a spiritual being, and it seeks for spiritual understanding. And this understanding that we are somehow this divine spark is coming through. And it's a big factor in the whole discussion of the way that people understand the reality of what they are. And it's interesting here that in the Genesis creation account, the fall of man comes through knowing that you are like God. The knowledge frees you. And I want to show you how that works out by trying to answer this question. I don't know if you guys are aware of this at all. There's been a lot of discussion around this. The question is, what is a woman? And this guy, Matt Walsh, has made a documentary about it. He's a little bit provocative, trying to get a discussion around it. The answer to what is a woman in today's construction is that womanness is a socially constructed category. We create it. It is a state of identity. Identity. It is associated, but not limited to being female. So what is a woman? The definitive article is anybody who identifies in that way, as long as the identification is authentic, and that the authentic nature of that is confirmed by an external judge. It is not for us to decide. Somebody else will decide whether that's authentic. That's why when I identify as a female weightlifter and I break a lifting record, and then I return back to my identification, you don't break any women's records because you're not doing an authentic identification. This has come into prominence recently. So this is one of the judges that was recently appointed to the U.S. Supreme Court, and she was asked by one of the senators, can you provide a definition for the word woman? Can I provide a definition? No, I can't. I'm not a biologist. She slipped up a little bit there, because you're not supposed to use biology to determine your gender, but she's deferring to an external expert. The true knowledge lies outside from you. Somebody else gives that to you. She's then said, I think you're the only Supreme Court nominee in history who has been unable to answer the question. The judge then again declined to answer the question and said, she said, truthfully, I know that I am a woman. I can identify with it. When you read something like this, which I found on a Gnostic exploration website, you can see that we have a divine spark in us. The purpose of this is to awaken that spark, to give it life, to give it energy, so that you can be transformed. And this flows into what is the gender unicorn. The gender unicorn is how you can understand your true identity and your true essence. But you discover it. So you discover your true identity as male, female, or binary, how you wish to express that. You discover your sex assigned at birth, your physical attraction, your emotional attractions. This is a framework now for teaching children about what is real, about how to understand human identity. And so in this process, you uncover the divine spark, the true you that is trapped in this flesh. And by throwing off the flesh, you're able to move out beyond. You reject the prison of the flesh, you release the divine spark, you find your true identity. I like minions. So I just want to use that as a stopping point and say, from a broad philosophical framework, I think this, for me, has been very useful to understand why the transgender movement has exploded and has gained so much traction. For these things which are so, I believe, contrary to what we can see with our own eyes, to create such momentum, how can a Supreme Court justice say these type of things? What type of framework must be in place for that to happen? I think this provides an interesting framework. It's obviously not the full answer, but it is a very interesting handle, a very useful way of thinking about what's happening. I'm going to change gears quickly. Second phase. I use pictures. If you struggle to learn, it's all about the pictures, and that's how I roll. And I'm going to use these 4 pictures to give you a framework to think about the transgender issue. And that when you engage in discussion next time, you can have a thoughtful, careful discussion and not just end up shouting at each other. You can actually shed some light instead of just raising the heat in the room. So we're going to start off with Caster Semenya. When we talk about transgender issues, what we are doing is taking a multitude of categories and lumping them together into one thing. And that's a mess. The problem is that there are discrete clinical categories in this large term. And if you conflate them as jy hulle meng, you end up with a mess. So the first category that I want to give you, and the archetype of that in our society, is Caster Semenya. So she has a disorder of sexual development known as a DSD, or intersex is the term that's previously been used. Sex is linked to reproductive function. There is no discussion about this. This is how we come to the conception of sex. In mammals, you need a female and a male. The female gives the egg, the male gives the sperm. It creates a new, unique individual. It is linked to reproductive function. You need to go to an English university, to an English department or a sociology department for 4 years to be dissuaded of this idea that sex is somehow a spectrum. You can inherit problems like any other medical condition in your genetics or in how you make hormones that are linked to your sexual development. And it's exactly the same way as I could inherit a hole in the heart or the genetics that make me bald. You know, I don't know why my dad's got quite a lot of hair there, but so there's two categories in this. You can have a genetic problem or you can have a hormonal problem. The genetic problems are clearly defined, well understood. They've got syndromic names for them. Turner described this. So a female is XX. XO means there's a missing X chromosome. Turner syndrome, classic phenotype. You look in a certain way, short, stocky, shield-shaped chest, wide carrying angle of the arms, short neck. Trisomy X, 3 X chromosomes. The most common trisomy that we know about is Down syndrome. So it's an inherited condition with abnormality in your genes. Klinefelter syndrome, males with an extra X chromosome. That's the code. Now you can have a problem in the code, but you can also have a normal code and then a problem in how you make the hormones. And a human body that is not exposed to testosterone will develop as a female. That's a normal process. So you can be genetically male, XY, but your hormones don't work, and so you don't make testosterone or you don't respond to testosterone. And so when you grow, your blueprint is male. You may even have testes. You're making testosterone, but your body doesn't respond fully to it. And so when you're born and the doctors look at you, they say, oh, it's a girl. There's no penis, there's a vagina. The child starts to grow normally, then hits into puberty where the testes, if they are there, starts to produce testosterone. Now the child is being exposed to higher than normal levels of testosterone, and the child grows taller and stronger, more masculine features, more muscle mass. And then they run at school and they win, particularly in the short distances under 1,500. And then they run in the region and they win. And then they run nationally and they win. And then they get selected to run internationally. And then they drug test the people, and their testosterone levels are 3 to 4 times above that of a female. And then the whole thing comes out. So the relationship between intersex and these conditions and sport is very, very well known because of what I've described to you exactly like this whole story. And the whole discussion around Caster Semenya has been around, should she be allowed to compete at the normal testosterone levels that she produces, or is that an unfair advantage when she runs against other women? When we talk about intersex conditions in South Africa or trans issues, people think about Caster Semenya, and then they use her to talk and argue around the transgender issues. Caster Semenya is not transgender. And it's a major problem, and it's an illegitimate way of arguing to take an example from her and then to apply it to the transgender issue. We can take learnings from it, but these are not the same. Right. Next category. This is, Bruce Jenner. Now, Caitlyn Jenner was crowned Vogue's Woman of the Year in 2017. In many ways, a male caricature of what a woman is. I don't know if your mom looks like Bruce has made herself up to look, but it's a male understanding of what a woman would be. So Bruce represents the classic transgender person that we've seen and learnt in medical school. I'm going to just touch on gender and definitions quickly. What is gender? Women have got feminine characteristics, and men have masculine characteristics. If I look at 1,000 men, I'm able to abstract characteristics that they share. Does every man have every male characteristic? No. Does every woman have every female characteristic? No. If I look at 1,000 dogs, I can describe what a dog looks like. But if there is a dog in front of me that has got one missing ear, one leg, no tail, and somebody shaved all the hair off, and maybe it was an accident and lost part of the nose, I can still see that there is a dogness to this dog. These characteristics are anchored in biology, but the expression of the gender varies by culture. The gender identity is how I feel about my gender. I feel male, I feel female, I don't feel male or female. Now, just an interesting point. If I am born male and I am a male, how can I know what it feels like to be a woman? How can I project myself and think that I am female if I am a male? It's a very interesting article, quite a seminal thing written by a guy called Thomas Nagel. He says, what is it like to be a bat? And he talks about the only way that we can know what it's like to be a bat is for us to imagine what it would be like for me to be a bat. And so I have to imagine what I think a bat would feel. I can never experience what the bat is. And taking that insight and pushing it onto here, this is why Bruce's expression or understanding of what a woman is in many ways a male's understanding of what a woman is. Because how can I know what it means to be female if I am not a female? How do I have access into that? How I express my gender is how I present it to the environment, through my behavior, my mannerisms, my appearance. So I've dressed in the South African white male uniform, blue, the khakis, the shoes. If I came to you, and we do this in categories of male or female. So if I was wearing a dress now with this shirt, you would feel uncomfortable. It would break the cultural norms of the expression. It's interesting, if you think about it carefully, that these things that we are putting out vary according to cultures. If I was in Scotland and I was wearing a kilt, that's fine. Men in Scotland wear kilts. So the way that I am presenting this in many ways is terminology around this is it's an accident. It's not essential to being male or female. These things change. They vary through cultures. They vary through times. What this doesn't do, what this expression is, it doesn't talk about the essence of what a man is and what a woman is, and linked to that in human, linked to biology and reproduction. I am a male because I am XY, and my body is orientated to the purpose of maleness and generating sperm, and a female's body is organized and structured around the principles of generating and holding life in her. That is the essence of what it is. These things are accidental. They're not central to the core. And the whole discussion that we have around transgender issues comes around these accidents. And they make the accidents the essence. This has got me into a lot of trouble. Gender is not a social construct. It's not wholly a social construct. Gender is anchored in biology. The whole concept of gender expression avoids the essence of what male and female is. And these gender expressions differ across cultures, but that doesn't impact this core of what it is. And trying to separate gender from biology is trying to separate the waves from the ocean. It's very difficult. You get into deep water really quickly. So this is Bruce Jenner, persistent gender dysphoria. These people have got this massive unease around who they are. They have that locus of anxiety around it in their gender. I should have been born a girl. I'm biologically a male. It causes huge anxiety. It causes a massively debilitating impact on their life. High incidences of suicide, high incidence of alcohol abuse, substance abuse, difficulties holding down jobs, a lot of other comorbidities. It is incredibly rare. In men, 1 in 20 to 3 in 20,000, and in women, 1 in 50,000 to 1 in 30,000. More common, much more common in men than in women. Today, we are seeing 10 times more many girls than what we're seeing as boys, and we're seeing it in a rate of about 1,000, 1 to 1,000 to 1 in 500. So about 2 to 3 girls per high school that I've been involved with. What's happened currently is that people say, studies where they've taken somebody like me who's gone through puberty and they say, I've got gender dysphoria. They say, well, if we dress you as a girl and as a woman and present socially, does that reduce your anxiety? Is that a way of making you feel better? Does that reduce the suicide rates? Does that improve my quality of life? And in longitudinal studies over 10 to 15 years, they found that people have very poor outcomes. There's a transitional period, a honeymoon phase between 3 to 7 years where guys do well, and then often the problems start to resurface. So an argument was made in a trial run in the Netherlands where they said, well, when you try to dress me as a girl, it's obvious that I'm a guy dressing as a girl. But if I can stop me from gaining my height, my Adam's apple, my fine masculine features, by giving me testosterone and estrogen and testosterone blockers, I can potentially pass as a girl. And if my integration into society is better, then my chances of living a healthy life and risk of suicide goes down. And so the gender affirming model that has been adopted and then supported by these standards is when the child starts to go into their second phase of puberty, so the breast started to develop and the penis and the testes started to develop, you give them puberty blockers. At 16, you start cross-sex hormones, and at 18, you have surgery. That's where the medicine side of things stand at the moment. Understand that it's coming from Bruce Jenner, that picture of that person, right? So, Caster Semenya, there'll be a small quiz at the end of this. As jy nog nie reg kry nie, is jy in die moeilikheid. DSDs intersex, persistent gender dysphoria. Now we start to get into the stuff that you are running into and starting to see at school, transient gender dysphoria. What we've seen is that children who present to a child psychiatrist or psychologist with severe gender dysphoria, the majority of them do not persist into adulthood. We're talking between 60 and 80% of the children who present to a child psychologist will, once they've gone through puberty, no longer have gender dysphoria. It'll disappear. And this has been consistently shown from data from the 1960s, 70s, all through up to now. There's a maxim in English, a lees of a motto that says, first do no harm. So if you do nothing, not nothing, if you support the child, if you understand their environment, if you provide them with broad, holistic care, and you support them, the majority of them will no longer have that gender dysphoria. In these groups, there are high incidences of autism. So children with autism have got a very fixed, rigid way of seeing things. A man must wear blue shirts. I don't like the color blue, and so I can't be a man. Or girls have got long hair. I don't like long hair, or I feel uncomfortable with long hair. I can't be a girl. Particularly boys, high incidence of autism, Asperger's type disease, and then also high incidence of same-sex attraction. So the kids are going through puberty, all the boys are talking about the girls, I'm attracted to the boys, I don't fit in, my sex causes me gender dysphoria, and it presents like this. There is no reliable means to predict who will persist and who will desist. That is like an absolute constant feature presented by the top international guys in the world. This is one of the Dutch guys, Steensma, who writes, he says, before the age of 10, we suggest a cautious attitude towards transitioning. Some girls who were almost but not entirely living as boys experienced great trouble when they wanted to return to the female gender role. We believe that parents and caregivers should fully realize the unpredictability of the child's psychosexual outcome. They can't predict. Those that think that they can are deluding themselves. But he picks up an interesting point here. The girls who wanted to return struggled to return. Data shows that if you do transition the child, close on 95 to 100% of them will persist with the gender dysphoria. So out of 10 children, if you leave them and support them, 6 to 8 of those children will resolve. If you transition them, you create 10 gender dysphoric children, and it persists. And just on its absolute face, that seems to be illogical. This has been picked up in the concerns about how we are dealing with children and this whole gender thing, and the concerns about the unthinking gender affirmative model has been picked up by Sweden. In the UK, there's been reports about concerns around this out of Australia and out of New Zealand, Finland. There have been statements made by the French Medical Academy, making statements that we need to be careful how we apply the science to children. We need to understand the limitations of it, and we need to understand that the science in of itself is very, very immature. I wrote an article with a psychoanalyst from Australia, which he published in one of the psychiatric newsletters here in South Africa, titled Managing Gender Dysphoria in Children, A Need for Caution. So it basically highlights the inconclusive nature of the evidence supporting the management of children and young people with gender incongruence and dysphoria. The importance of treading slowly, carefully, and humbly has been highlighted by the news that the NHS is facing a class action lawsuit claiming clinical negligence being brought against the Tavistock Gender Clinic. And I put in a quote out of the French Medical Society that says, "Great medical caution must be taken in children and adolescents given the vulnerability, particularly psychologically, of this population, and the many undesirable side effects and even serious complications that can be caused with some of these therapies." When a child transitions like this, after 2 years, so when you go into your puberty block, as guys present it as though it is a pause, a moment to consider who you are and where you are in the whole process. The problem with that is that your whole integrated body development is linked to your growth, your brain growth, your normal physical maturation. You are feeling different from your peers. We put you on hormone blockers. All of your peers continue to develop and grow, and you stay static. There are severe or serious concerns about issues around fertility, bone density in the long term. When you start to check cross-sex hormones, infertility issues are almost guaranteed. Problems with blood clotting, pulmonary embolisms around that, heart attacks. Then you start to have all the surgery complications from the surgery itself, infections, nerve damage if you do mastectomies. And then what very few people talk about is the bottom surgery. It's easy to put in breast implants or to do a mastectomy. When you start trying to create vaginas and penises, and you get infection rates, and in some of the Dutch studies, there's mortalities that are followed from this. This is a huge undertaking, massive, with ramifications that we don't understand. And it's not me saying that, it's these organizations that don't have an axe to grind. They are the ones that are speaking as national health organizations. So when people say there is no debate around transgender issues and the medicine around it, that's an absolute lie. It's all of these organizations say, these countries say there is concern around this. We don't understand it. D-sisters. So, DSD intersex, Bruce Jenner, persistent gender dysphoria, transient gender dysphoria, and then we jump into the one that's happening in the schools and where the big debate is at the moment. This has been termed rapid onset gender dysphoria, a lot of unhappiness around this term. This occurs in young adolescent girls, generally, between the ages of 14 and 18, in female to male clusters. This is unheard of. It is totally new phenomenon. It's normally individuals It's predominantly male. Now all of a sudden it's girls, which is atypical, and they are in groups. They have a close relationship. Either they're in the same school, the same sport team, they're in some type of club, they're friends online. And when one transitions, the rest of them will transition as well. And if one transitions, there'll be kids around them that will then come out as non-binary or gender-seeking, and they move together in a group. These children often have no prior history of gender dysphoria. Now, the classic gender dysphoria picture is that the children will say that they've had that gender dysphoria from as long as they can remember. When you interview these kids' parents, they'll say, my girl was happy, Barbies and the ponies and everything, and then all of a sudden, she's saying she's got gender dysphoria. It has the features of a craze. So you will see, if you look at the sort of the presentation percentages in countries, it goes from nothing to these huge peaks, and now we're seeing in places like Sweden and Finland, the peaks are starting to come down as the consequences of the fad wear off. You will see it sparking off at one school, and then in another school, and then on social media to another one. It almost looks like a contagion. And it has a high social value. It's a high social value action. If you are not part of the in-group, and you're feeling out and different, and maybe you're a bit of a tomboy, and now all of a sudden, and you're going through puberty, and you're feeling a bit clunky and pimples and lumps and bumps, and all of a sudden you come out as transgender, your social value shoots up. You're applauded for your bravery. You get huge attention. Now you have a reason why you're feeling like you don't fit in. And that ties into this cultural zeitgeist that I mentioned, and so your social prominence gets lifted up. This is very common, or more common, in children with depression, anxiety, cutting disorders, and eating disorders. And when I talk about this at schools, particularly at the girls' schools, 60% of all the teachers start nodding their heads, because the children that have come out of the blue, seemingly, as trans, are kids that fall into this category. And it is strongly driven by social media, massively driven by social media. TikTok is the initial latching point, and then on sub-forums on Reddit, Tumblr, and then tutorials on YouTube. The rules online are, 1, if you think you are trans, you are trans. Number 2 is nobody cares about you except your trans family online. Everybody is trying to hold you back and suppress you. And number 3, when you get the testosterone, which is called T, your life will get better. But just think about that. I don't know how particularly organized and put together you guys felt coming through puberty. How suave, how clear of your identity. You just knew exactly where you were, how to live your life. Which of us have not felt doubt about who we are and who we're going to become? Because that is the very essence of adolescence, is moving through this phase. What happens when you have been abused as a young girl, and now to protect yourself, you no longer want to be this girl that is vulnerable, but you want to identify as somebody that is powerful, as a man? Because if I'm a man, I'm not going to get sexually abused. So if I come into this environment with that, I'm unhappy about my gender because of what's happened to me, and I go online, the answer is, you're trans. What happens if I've got depression? What happens if my mom died? If we've just had a divorce in the family, and I'm feeling depressed and down, and I don't know who I am and where I am and what is my grounding, my position, and I walk into this. And this is one of the big aspects that this psychoanalyst that I worked with, Robert Angelo, talks about, saying to see children with complex problems as trans is to betray their wholeness, the whole person. It's what we do, oh, you're the heart in row 1, oh, you're the liver in row 2, as the doc. That's not true. It's a person. And one of the big problems in this cookie-cutter approach is that it denies the integrated wholeness of these children struggling with gender. In my mind, there's a lot of what's happening is medicalization of puberty. The normal process of puberty is being put on and made dysfunctional in some ways, and the vulnerable children are being pulled out of it. It ties into this social zeitgeist that gender is a social construct, so you are what you think you are. Interesting enough, there's forums that reject the need for dysphoria. Because if I can be whatever I want to be, why do I need to be uncomfortable? Why do I need an excuse for the dysphoria? If gender is fluid, then I can be what I want to be. And who is the doctor to stand in my way to make a medical diagnosis? If I want the drugs, I should be able to get them. And it's been linked with aggressive activism, which is the reason for my long disclaimer at the beginning, and the reason why everybody asks me, what are you speaking on? And I say transgender issues. They go, oh, you're very brave. But it's that aggression around it, the ideological push around it, that links on top of this. Very interesting book, Irreversible Damage by Abigail Schreier. She's a progressive liberal, but she writes about this craze that's seducing our daughters and the consequence that it has on them. And we're seeing the consequence come out in lawsuits in Sweden, Finland, and now in the UK, when children who have been going through puberty and problems in puberty have been pushed down the transgender pathway, come out at 21, 22 and said, what the heck did you do to me? I'm infertile, I've got these problems. What did you do to me? How could you do this to you? How could you let this happen? Right, DSDs, persistent gender dysphoria, transient gender dysphoria, and rapid onset gender dysphoria. Hierdie is nie dieselfde nie. These categories are not the same. It is illegitimate, it's dishonest to take data from Caster Semenya and apply it to the 14-year-old girl in your high school. It is not appropriate to take the issues around Bruce Jenner and apply it to DSD or to the 14-year-old here. And although there's maybe some understanding about these three categories, we do not understand what is happening over here. And the guys that are honest about it, and there are those in the academic thing, saying, we need to be careful. We don't understand what is happening. Steensma said, before 2000, we were seeing 3 times the number of boys to girls. Then all of a sudden it was the same numbers. Now we're seeing 3 times many girls than boys. The whole disease profile has changed. It's like finding a new disease in your midst, but then still trying to use the same tools to try and treat it. Die pylvak, ons is in die laaste bietjie. Shifting gears slightly. Is this a good thing that we are doing to these children in principle? I want to talk metaphysically, I want to talk morally. Sex is genetically determined. That it is. We talked about die waarheid. Dit is die realiteit. Dit is wat ons is. Kan jy dit verander? Nee. And that's in many ways a lie that is told, that in some ways the people believe that we will become the other gender, the other sex. You won't. You can force your body to look like it, but it cannot become it. Sex is immutable. And the phenotype, the way I look, is an expression of the underlying reality. And this is the reality. And reality has a way of pushing itself and asserting itself. So I think an argument can be made that on a natural law argument that it is immoral to do these things. First, it is immoral to claim that sex can be chosen. The words sex assigned at birth. You don't assign a sex at birth, you identify a sex at birth. Yes, it's a phenotype, and so we can be mistaken, but there's an underlying reality that underpins it. I think it is immoral to present the sex as if it can be changed. So first, to claim sex that you can choose your sex, but then it's immoral to claim that you can change the sex. And then introduce it into schools as though the gender unicorn, you can choose, because you present an untruth. Dis 'n leuen dat jy kan kies hoe jy gaan wees, want die realiteit is, jy kan dit nie verander nie. This concept, we hear it a lot, to present the idea that somehow there can be a female brain inside a male body. Like every chromosome in your body contains your genetic XY or XX. You have no conception of what a female can be is because you are not that female. You only can look at it and think that's what it is. So these concepts, and also if you start looking at brain scans and stuff like that, men and women's brains differ predominantly just in the size because we're physically bigger than women. But in terms of what they are and how they look, they are much more alike than what they are different. Take this argument and then just shift it from the gender thing and move it to something else. There's a child that says, I want to be dumb. I wil nie kan praat nie. Not mentally dumb. I want to be blind. I want to have a hearing deaf. Would it be appropriate for me to inhibit the normal growth of an organ to achieve a perceived dysfunction based on my desire? Would it be appropriate for me to inhibit the growth of my child's eyes or ears or nose or any part of their body because they had a desire or identified as somebody who wanted to be blind? I mean, when I start saying it, everybody laughs, but that's exactly what we're doing here. Is it appropriate then later on to remove the eye or a limb? And there are people that struggle with this, body dysmorphic disorder, where one woman's had a desire, she wants to be blind, actually got it to a point where somebody poured acid into her eye, and now she is blind, or amputation of a limb. Does that seem appropriate? And if it is not appropriate, then how does that relate to gender? And particularly during puberty, when you're going through this period of vulnerability, this period of change, and then you're presented with these issues. The philosophy of transgenderism as an ideology is this concept that gender is a socially constructed word game. It is completely decoupled from reality, and you make it what you want it to be. If you think I'm a cat, then I'm a cat. And if I think I'm a dog, then I am a dog. So the implication of that is, if I think I'm fat, then I must be fat, mustn't I? And that's the exact core concept in anorexia, one of the psychiatric conditions with the highest mortality rates. And if I can be transsexual, why can I not be transracial? This is Rachel Dolezal, who presented as an African-American woman until she was outed. She identified Caucasian woman as transracial, but excoriated for that, totally cancelled. But what's the difference? If genetically I can transition my sex, why can't I transition my race? What about just going transspecies? This guy identifies as Boomer the dog when he's at home. What about a cat or a mythical creature like a dragon? But if you use the ideology and you're consistent with its application, everybody laughs, but this is the reality of it. And now you need to understand why people get so angry with you or with me, is because what they are saying is, when I think I am a girl, I am a girl. Hy is 'n vrou. And for me to say you're not a girl is to deny them their existence, their identity, their self-created spiritual truth. And when the guy says, I am a boy, the girl says, I am a boy, I am a boy. And when I say, nee, jy's 'n vrou, you are cancelling that individual, you're denying their identity. That's why they get so angry with what's happening, because they see it as an attempt to eliminate their truth, the Gnostic truth that we touched on. And what we're experiencing is this push that this transgenderism seeks to be normative. It's got a moral imperative behind it. It compels compliance. It's linked with radical activism, which is structured and planned, and it seeks to punish and destroy the opposition. We haven't had much of that here in South Africa, although groups of my friends have been reported to the Health Professionals Council, been reported to the medical councils, been reported to the university councils, trumped up stuff, all of it thrown away, but it's an attempt to silence it because there's a moral imperative behind this. And there we go. So we've touched on what is human being. And I want to contrast a realistic realism, what it is, versus a Gnostic viewpoint. We've swung past the medics, DSD, persistent gender dysphoria, transient gender dysphoria, and rapid onset gender dysphoria. And we've touched on the philosophical underpinnings of this stuff and the implications of that. En dis dit. Dankie.
Daar is nou geleentheid vir vrae.
Waar val die mense, in watter kategorie val die mense dan wat identifiseer as 'n ander geslag sonder om enige veranderinge aan te bring? So byvoorbeeld, ek sê ek is nie man of vrou, ek is iets anders van die 72, maar ek maak geen fisiese veranderinge aan myself nie. Waar val hulle dan in en hoekom word dit dan ook aanvaar as daar geen mediese agtergrond is vir dit nie? Dit is net, soos jy ook genoem het, dat ek is wat ek soos wil wees.
Sê ek is,
ja, so sê ek is.
Okay, so ek gaan net 'n bietjie terugstaan van daai vraag. Die eerste ding is om te sê, jou vraag vra, hoekom doen hulle nie iets hieroor nie? En 'n klassieke transgender individu soos Bruce Jenner, daai groep mense raak eintlik tot 'n mate kwaad oor wat gebeur in hierdie sosiale aspek. Because they have a true dysphoria that is busy dramatically impacting their life and causing huge dysfunction and disturbance in their life. And now a girl at 15, 16 decides that she's trans. It's like identifying with a disease process to gain all of the stuff around it, the social credit around it, but doesn't have enough of a drive to actually, there is no real gender dysphoria in it, if she's not acting on it. So for me, that's the rapid onset gender dysphoria, but without the gender dysphoria. And in many ways, commentators would say, in some ways, what they're saying, you said 71 different categories, it is so fluid. What it is a statement of, I am different from everybody else. And that's the extreme expression of this chain of events that is socially being played out in the schools and on the social networks. So they don't actually fit into this category. They are the extreme outflowing of the acceptance of this ideology. And I've said that the DSD is not the same. These ones are standing on the pseudo-medical framework of this and then using that to project themselves into this environment. And I've been involved with quite a few schools that have gone through this, and this is often linked with other issues as well, political stuff and the Black Lives Matter movement and wokeism and debates around social justice, and linked in those the transgender issues will come in, where somebody will do this, not really have dysphoria and even reject the dysphoria, but just claim that sex is fluid. So if it is fluid, I can be whatever I want. The difference and the reason that it causes so much friction is that, firstly, it's very clear for all of us to look at it and see this is not true. But if you said that I want to be male or female or whatever, and I just did it, then that would be fine. But what the problem is that they are forcing or demanding that we comply with it. That if I say I am this, I must be treated like this. So when I say that my pronouns are he, she, then somehow that puts a moral obligation on me to use that terminology when I speak to you. And in your identification that you can then go into change rooms and engage in the sport, and those things are what causing the huge degree of friction. Now, if I was same-sex attracted and I was in a relationship with another man, and what we did wherever we did, and the relationship that I had, what does that do to you? Nothing. So, but what's happening here is that it's not limited to just a self-identification process. It's pushing into becoming normative, which is the ideological extension of this. So hulle pas nie mooi in 'n kategorie nie. maar hulle is die uitvloeiing van hierdie proses en 'n samesmelting wat in die cultural milieu aangaan.
Jy het nou eintlik so 'n bietjie aan die einde daaraan geraak. Die ander debat is na suksesvolle transformasie en die deelname aan sport en of dit regverdig is teenoor die ander. So ek dink my vraag is, sou 'n man wat na puberteit suksesvol getransformeer het en dan nou aan al die vereistes voldoen van testosteroonvlakke verlaag en so aan, nog steeds 'n voordeel hê om dan teen vroue deel te neem?
So, in English, without a doubt, having a male genetic blueprint. So, if you got two cars and one is a truck and one is a mini, the truck is going to have the underlying infrastructure that will give you the advantage when you go through the dirt roads. So men, the genetic code for a man will be taller, will have more muscle mass. So even if you're suppressing the child from early on, there is an advantage on it. If the child has entered into puberty or has gone through puberty, the advantage is massive. And there's a whole lot of attempted counter-arguments, but the truth of it is you look at the top female swimmer, the sprinters, the wrestlers, the MMA guys, the highest weightlifters, they're all now men. So you have men presenting, looking like women, beating the women in their own sport, and everybody must stand up and say, this is okay. And this is what's led to this pushback from the feminists, which are now labeled as TERFs, trans-exclusionary radical feminists. J.K. Rowling is now the arch TERF. But the point that they're saying is that this is the ultimate invasion of womanness. The man is actually invading the very being of the woman, enters into all of the spaces that are women. You cannot define what a woman is. Their very existence has been made nebulous. So I've been involved in drawing up guidelines on how schools deal with these type of things in the regulations. And when you start coming to this, and there is room for the person to identify and to express as they wish. Because as an adult, you can do what you want to do, within limits, as long as it doesn't harm others and those. But when that identification process starts to push into the broader community, and that's what I was talking about, it's putting an obligation on a response, that becomes a problem. So when we start coming to the use of combined facilities, there's a hard line there, no. And the response that we've put in is to put in unisex bathrooms where required. And in the sports side, definitely not. Because of all of the stuff. There's an interesting guy who was actually in our school, Ross Tucker. He's at UCT, and he writes around these things, I think, very clearly and very nicely. When Kester takes testosterone blockers, an 800-meter time drops by about 3 seconds. And people say testosterone has no advantage. You look at some of these YouTube videos. You take the top 300 men tennis players in the world will beat any one of the top 10 on the female side. The punch power, the physical strength of a man will surpass that by a woman by about 130%. It's just the biological design of a man versus a woman. So I think it is profoundly disrespectful and undermines fundamentally many of the gains that the community, liberal community, feminist community has sought to gain in identifying what womanness is and freeing it up. And now in this attempt to try and be inclusive with this ideology, they're actually destroying that very thing. If you look at the whole concept of LGBTQI+, the only reason that you link them together is because they all band themselves together as oppressed. There is a lot of the lesbian groups are saying, you are transing all of our lesbian girls out of the lesbian community, because as soon as they identify as atypical, then they become trans children. And those children, many of them would have developed and become lesbian. And they're destroying, I'm attracted to a woman, I'm not attracted to a man that's presenting as a woman. So why are they linked to the trans? And so there's an inherent disconnect between those things. So.
Baie dankie. Ek het jou lesing verskriklik geniet. Daar's niks wat jy sê wat ek nie mee saamstem of wat ek, jy weet, enige vrae oor het nie. Wat ek wel interessant vind in my eie navorsing oor transseksualiteit en gender en seks, is die rol wat tegnologie speel, wat 'n baie stille rol is en dit bou op die gnostisisme. Voor ons die tegnologiese bydrae gehad het, was daar seker mense wat gevoel het ek is in die verkeerde liggaam, maar dit was 'n probleem wat jy op ander maniere moes oplos. En nou het tegnologie dit moontlik gemaak om regtig van een geslag, wel, ek dink ook nie jy kan van een geslag na die ander een gaan nie, jy kan lyk soos die ander geslag. So die rol van tegnologie is vir my baie interessant. En dan die onderliggende, en nou klink ek ook seker maar soos 'n turf, is die onderliggende motto wat daar staan is, moeder natuur het 'n fout gemaak, wat vader tegnologie moet regmaak. Ja. So dis ook al klaar in 'n gender diskurs ingeskryf, die hele rol wat tegnologie daarin speel. Maar baie dankie, ek het dit vreeslik geniet.
Ja, jy weet, sê tegnologie, toe dink ek aan die hele sosiale media komponent daarvan. Ook, jy weet, ons tegniese vaardighede om iemand te laat lyk soos 'n ander geslag is baie speel 'n groot rol in. The isolating effect that the social media has is very interesting, because it actually withdraws you out of a community that would push you towards, living in this community. It isolates you off, and then connects you with others that are on this thing. And Abigail Schreier's book, she talks a lot about it, and talks about how some mothers took their kids out of big cities, moved them out into the farmland areas, took away the cell phones, and 6 months later, that this dysphoria is resolved. So that fueling effect and the distortion effect around it, and it's well described in how the algorithms will take you down rabbit holes, and that becomes your absolute reality because it blocks all dissonant. So that technological funding effect is also very interesting.
My question actually leads from hers. What I've seen recently is basically, I don't want to oversimplify the gender topic, but is also people identifying with mental health issues as well, which don't have mental health issues. So I have anxiety, so that means I struggle with this and this, and you need to give me space because I have anxiety, and then they don't actually have the mental health problems. So my question actually leads to, how do we accommodate people that associate with transgender issues or with mental health issues but don't have mental health issues? Because usually from my perspective they have, I don't know, they feel they have depression maybe, or they feel like they don't belong somewhere. And how do we give them space to feel belong but without basically acknowledging them seeing they have the mental health issue without having the mental health issue?
Okay, so let me there's actually recently been a report of a guy, I think it's in Sweden or something like that, who identifies as transgender female and disabled. So is in a wheelchair but can walk. So but the same question is, so the person would then come to the school here, to the university, and say, well, I need accommodation for this. So the way that the whole framework in a little bit comes down to what is real. This is not real. The complication of it, or the implication of that, is that which is real gets diluted. So those with mental health problems, true mental health problems, they suffer as a result of the dilutional effect. It's like saying, I identify as a cancer survivor. That is a lie. That's a distortion of what's going on. The reason why they're doing it is there is a problem in that. They're identifying with for secondary gain or an aspect of that. So there needs to be a help process on that. Part of in our culture that we're struggling with, when we talk about rights, there are negative rights and there are positive rights. Negative rights is a right not to be harmed, the right for free speech, the right to freedom, the right to free association. They don't put a burden on anybody. The right to education, the right to healthcare is a burden. Somebody else must give it to me, and the state must give it to me. So if you look at what's happened in our societies over time, there's been a progression away from the negative rights or the neutral rights are accepted, but more and more the state must give me this, we must give it. This is an extension of that type of thinking. My desire for anxiety relief is your problem. My gender identification is your problem. And when you don't do what I want you to do, then you are oppressive and homophobic and transphobic and fatphobic and all of that type of stuff. So how do you identify, how do you help that person? You treat them with respect as an individual, and then depending on the circumstances and the environment that you're in, you refuse to accommodate what they're asking. So I have a very aggressive belief that you treat every individual that stands in front of you with absolute respect. And you take them seriously and you listen to them. You can learn from people. It's the type of behavior that I want when I discuss with somebody or engage with them. That's what we want in a society. But there is a limit to what that person can ask of me. I can give you stuff freely, but you cannot start to redefine reality for me. So if I'm engaging with a trans person, I will respect them. I speak to them on the first name basis, but they are not the gender that they're identifying with. They should not be allowed to use the bathrooms. And now, how do we share this space together? Well, I think the way to do that is have a unisex bathroom. Because some people, and I've spoken with trans individuals that look so female that I didn't know that they were trans until they told me. So now, am I going to do like a sex check before they go into the bathroom? That doesn't work. And does that man who looks totally like a girl then go into a male toilet and then get abused potentially because that doesn't work? So I think, how do we work around the thing? Let's find a system in a society that's pluralistic, that has respect for individuals, and we come out with, I think, an elegant solution for that is a unisex bathroom. How do you deal with somebody like this? Well, to the degree that we can give them space that's rational and thoughtful, let's do that. But every positive right has a cost linked with it. So I demand free healthcare. Well, the state will pay for that. Well, who funds the state? Well, you fund the state because you have to supply it. So there is a resource allocation cost that's linked onto that. So what does it mean, give me space? What demands are you putting on me? When it comes to language use, do you demand that I use certain language? And this is what got Jordan Peterson in so much trouble. And I think there's a very good argument that he makes in that the way that we use language shapes a lot of our thinking. I don't know if you guys have read George Orwell's 1984. The way, if you take tools and access to language away, it forces your thinking in certain ways. And this freedom of expression, and that I have the right to speak, you can tell me what not to say, but you can't tell me what to say. So when you start running into those things, and I think it takes time, you need to think it through. And each situation differs and varies. How do I respond as an individual? How do we respond as an organization? How do we respond as a society? Those levels are different depending on who you're working with.
Excuse me. Now we know a lot of parents in the USA in particular puts their children on puberty or hormone blockers. So they argue that it's a good thing and that it can be reversed. They say it can be reversed and that they know what is best for their child because their child says he or she is trans, or mom or dad, I feel like a boy or a girl. So after the child becomes an adult, and let's say they want to transition back because they realized they made a mistake, and after they went through all these hormones and puberty blockers and they didn't go through puberty, does the hormones initially actually destroy the body when they want to transition back? Can they return to the previous sex because now they never were fully male or female when they transitioned, but now they want to go back, but it won't be 100% the same? So what would be the effect on the body when transitioning back?
Okay. As you spoke, it reminded me of something that I wanted to say. one of the big arguments that you've mentioned here is that it will make my child better. So yes, when you start children on puberty blockers, a lot of them's anxiety goes down. If you have got shortness of breath from cancer, and I give you morphine, your anxiety, the air hunger goes down, but it doesn't treat the core problem. So the fact that you are treating somebody and their anxiety goes away doesn't mean that you've dealt with the underlying issue. Also, there's a placebo effect, which is where people respond just because they're getting attention. And it's well documented, this 5 to 7 year lag period. So the fact that all of a sudden people seem to get better, that's debatable. There's one study that's been done by the Heritage Foundation that looked at the suicide rates in the US in states that are gender affirmative care and compared it to the teen suicide rates in states that don't support gender affirmative care. And their data shows that after the last 5 years or 3 years, the rates of suicide in teens has gone up in states that implement gender affirmative care. And if the theory that I put forward is true, imagine taking a child who's struggling with their identity and then forcing it down a pathway that they never wanted to go, solidifying that dysphoria, and then walking away from the person. The consequence of that would be more dysfunction. So to your question is, once you interrupt the process, the reversibility depends on the degree and the duration that you've been on the blockers for. So if you're on the blocker, you restart, depending on how long you've been on that blocker. So normally it's a 2-year period because the guys will then start transgender hormones. There's a chance that you can recover some of that growth and that recovery. The bone density stuff, people are not sure. Maybe there's some chance of recovering that. The thing is that most people that go into puberty blockers do then start on the cross-sex hormones. And 2 years on the cross-sex hormones will cause irreversible change. So it's often girls, they will take on more masculine features. Taking estrogen again will soften some of that, but it doesn't change some of the structural bone changes. A lot of the guys struggle with voice changes. So a male has a deeper voice because they've got longer vocal cords, and they don't recover that. And then also, they often have alopecia. So the reason that I don't have hair is that testosterone gets broken down to dihydrotestosterone, and that causes hair loss. And girls that end up taking testosterone will end up losing their hair as a side effect of this. Sometimes that doesn't grow back. So you can find these clips on YouTube with these children crying or really upset and look at me. They're stuck in this intermediate process. If you still have your testes or your ovaries, if you withdraw the blockers and the cross-sex hormones, then you will take on more of those features. You will revert back. If you've had surgery, obviously, then some of that is reversible. So some guys that detransition will remove implants. Some girls will get implants so that they have breast tissue again. Most people don't have bottom surgery because of the invasiveness and the complications of that. So to a degree, there is some reversibility. You'll never return back to what you had. Maybe if you were on blockers for a year or two, there's a chance that you'll be able to recover on that. The gap in growth and development that you've had with your peers will remain. That becomes less important when you graduate or you're a little bit older. And we're not sure about how you develop as an integrated whole. What happens when you block brain development? What happens when you block your whole development in that process?
Goeienaand dokter. Ekskuus, ek wil net gou 'n paar van my vrae was nou al geantwoord hier vanaand. Ek wil net ek kyk baie video's van Piers Morgan en Ben Shapiro, daai manne. Ek kyk bietjie vir hulle partykeer en ek wil net ek gaan nou terug na die Caster Semenya situasie toe. So as Caster Semenya hulle daar nou op die testosteroonblokker gesit, maar sy het mos 'n disorder.
Ja.
Okay, so maar hoekom neem sy dan nie eerder in die Paralimpiese spele deel nie, omdat sy 'n disorder het nie? Ekskuus, dis Jenny en ek dis 'n wettige vraag.
Okay, so sy het ek's nie seker nie, maar ek dink my aanname en ek voel jammer vir hom dat sy is die persoon wat ons almal oor praat, maar sy het een van hierdie intersex toestande en waarskynlik androgen insensitivity syndrome of 5-alpha reductase deficiency. So sy's 'n biologiese man met waarskynlik met testes wat testosteron maak, maar haar liggaam respondeer nie daarop nie. Okay. So sy lyk vroulik, sy hardloop teen die vroue, sy het 'n skeletal muscle mass advantage and she's got a high testosterone advantage. Dis hoekom sy wen. En ek dink daar's een of twee ander 800 meter nalopers wat dit ook het. En daar's 'n Indian sprinter wat dit ook het. Jy vra wat van die Paralympiese spele? The Paralympic Games have got specific categories in which your condition is listed. So it's visually impaired and there's subcategories running. There's about 4 different ones. So you can see to a degree, you can see a little bit more, you can see nothing and you need to be led. You can have a single amputee, you can have double amputees, you can have double amputees with prosthesis. So daar's baie kategorieë vir daai. So daar is nie 'n kategorie vir iemand wat interseks is nie. Omdat dit so raar is en dan ook 'n hele debat oor wel mense sê maar sy's 'n vrou, sy moet maar net hardloop saam met ons en dis hoe sy is. So ja, die vraag wat jy vra is interessant want een van die punte wat mense maak is as hy die mans is wat nou trans is, so I'm a trans female biological man, hoekom en ek hardloop nou teen die vroue, wel hoekom hardloop jy nie teen die mans nie of hoekom hardloop jy nie in die oop kategorie nie? Want deur dit te doen beskerm jy dit wat vroulik is. Jy laat die persoon toe om deel te neem in 'n ander kategorie waar hulle wil wees. Meeste van hulle kan nie kompeteer teen die mans nie omdat hulle estrogen vat. So jy weet in power events they will always lose as a result of that. So implicit in your question is die idee van wel wat van 'n verskillende kategorie, maar daar is nie so 'n kategorie in die Paralimpiese spele nie.
Ekskuus, kan ek nog ietsie hoor asseblief?
Seker.
So ja, ek het ook al gehoor van hierdie goedjies wat ek so gekyk het. Hulle sê dat sê nou maar ek gaan nou dood. Ek identifiseer as 'n vrou hier waar ek nou sit, maar nou gaan ek dood oor 100 jaar grou hulle my bene uit. Wetenskaplik en biologies alles gaan hulle fisies sien ek is 'n man.
Ja.
Dan hoekom is dit reg dat mense ek gaan nou sê ons het vryheid van keuse, maar hoekom mag mense die keuse uitoefen? Ekskuus, as ek probeer nie op tone trap nie, ek beloof. Maar as mens jou keuse kan uitoefen van neem, ek is nou 'n vrou. Ek wil soos 'n vrou gehanteer word. Ek hardloop volgende week Olimpiese spele vir vroue afdeling 1500 meter. Maar dan grou hulle my bene oor 100 jaar op en ek 'n man eintlik, soos dis net waar ek ook wil aansluit by dokters, soos dit maak sin, maar dis 'n probleem.
Ja, so wat jy uitlig is die kern van waaroor ons nou gepraat het vandag. Ek sê daar's 'n biologiese realiteit wat ons almal van bewus is. En die vraag is hoe kom ons tot op 'n punt waar iemand so iets kan sê en mense neem dit amper ernstig op. 50 jaar terug sou mense gelag het. Nou verander ons wette en alles as gevolg van hoe kon ons beweeg van hiernatoe tot daarnatoe. The biological reality, the reality versus the pseudo-reality that's been created. En wat ek probeer hierso skep is daai idee van hoe het ons uitgekom nie, maar watte omstandighede bestaan dat ons hierdie ding kan sê, dat so iets kan sin maak en dat mense daarop sal respondeer. Maar jou vraag is biologiese realiteit 100 jaar later, ja.
Baie dankie dokter.
Hierso.
Hallo, sorry.
So ek wil half net ek wil vraag vra en dan net iets half byvoeg. Maar ek vind dit baie snaaks dat hulle kan verwag van kinders of kinders volwasse genoeg ag om te kan besluit of jy nou 'n vrou of 'n man is, maar jy is nie eers volwasse genoeg om te kan stem vir 'n party in die land nie. Of om te gaan werk nie. So dit maak dit vir my glad nie sin nie. En dan is my vraag net
Ja, maar kan ek net op baie punt
ja.
'n stelling maak? daar's 'n papier wat geskryf is deur 'n vrou, Gail Rubin. It's the seminal work in genderqueer studies. En dit verduidelik hoe hulle dink oor kinders, hierdie ideologie dink oor kind. So we talk about a child being innocent and having no sexual identity. They say that is an imposition of society on the child. The child, in their mind, is a sexual being that has sexual desires and should be allowed to act out on them. The child has absolute agency. And part of the work of the queering process is to break the normative structures down in society which are oppressive and allow true freedom to come out. So Gail Rubin argues around the trans issue, homosexuality, and in this classic paper she argues for child pornography and child sex as being a good thing because the inhibition on it is a cultural norm that is oppressive to the true sexual freedom and liberation on it. So this paper is written about 1970, 1960. That paper captures the true understanding of the way that they see this. So they are not only saying that this child can choose the gender, and they don't believe that there is a gender. Wat ook al, daai kind voel op hy oomblik is reg, en daai kind moet die reg hê om dit uit te oefen, en ons moet daai kind help. Maar ons moet ook vir die kind vertel van, jy hoef nie nou net soos almal so seksueel te wees nie. Jy kan met enige iemand sê enige tyd, you're a sexual being, the child's sexuality needs to be explored and opened. They talk about queering childhood. So with that framework, that extreme of it, you can understand how looking at a child, the ideology goes, yes. En met dis nou daai ideologie wat daar loop. En dan vat hulle al die mediese goedes en voeg dit op en bou nou die platform om van daai aksies dan te vat. So that's how they get to their thinking. And I agree with you. I mean, when you're 16, you don't know what clothes you're going to wear. You want an iPad, you don't want an iPad. You don't get married at 16. You can't make a decision about that. Now you're going to choose your lifelong sex, and there's somebody with a scalpel or a syringe waiting for you.
Ja. My vraag is dan, as dit so duidelik is of so baie keer bewys is dat meeste mense wat transgender of wat skielik besluit hulle wil 'n kat wees of iets, so sukkel met depressie of angs, of hulle was mishandel toe hulle jonk was of so. Verstaan ek net nie hoekom hanteer hulle of dokter het vroeër iets genoem daarvan, van die essence of die kern van die probleem, is hoekom hanteer hulle nie die kern van die probleem nie, maar eintlik vererger hulle dit en stoot hulle daai angs of onderdruk dit eintlik net vir 'n rukkie, maar dit gaan nie weg nie, want daai kind of daai persoon gaan nog steeds onseker wees, hy gaan nog steeds aan depressie ly, want daai onsekerheid word eintlik net meer meer bevorder. Ja. So ek verstaan net nie is as hulle dan as 'n kind of 'n persoon dit begin bevraagteken, is hoekom word hulle gestoot in 'n sekere rigting en hoekom hanteer hulle nie daai angs of depressie se kern nie.
Okay, so the talk and the framework that I've given to you comes out of how I understand this. It's a confluence of what I believe to be real and what I believe around the medical literature. So a trans activist or a gender transition specialist would stand up here and reject the majority of my foundational aspects. So say, dit wat ek sê is rubbish. Dit is nie so nie. And then they would fight about the medical components of it. And so let's say that the person is trying to act in the best interest of the child and doesn't have an extreme ideological bend. They will look at the literature and say, this child is trans, or has gender dysphoria, and the gender dysphoria suicide rates are high, and the Dutch studies suggest that the patients do better, and so the morally right thing to do is to transition. And because of the Dutch studies and the results, and because I've seen putting people on puberty blockers takes away their anxiety, the right thing to do is to transition them. And what I'm saying to do is to wait is immoral. So hulle gaan sê dit is verkeerd. So this die individu, if it's done properly, because there are people with Bruce Jenner is out there in the whole group. If it's done properly, and this is where D'Angelo comes in with the psychoanalysis, in the past we would take those guys, talk them through, it's a whole process of understanding what's going on, find out about all the aspects, understand the person as a whole. The cultural thing at the moment is, and the ideological push has said that now when you say the words, I am trans, it is immoral and in some countries illegal to try and talk you out of that. So I cannot explore, what do you mean by that trans? What do you mean by gender? What do you mean by male? How are you feeling? You can't look at those other things because to say the words, I am trans, is to lock yourself into this process. That's what gender affirmative care is. So die probleem is dat jy nou die oorvleeling kry van 'n mediese behandelingstegniek wat ek dink nie reg is nie, gebaseer op die data, maar wat baie mense dink is die regte proses om te volg. Plus die ideologie wat sê jy mag nie hierdie ding omswaai nie. En omdat you may not do any conversion therapy, which means you may not talk about it at all, it's an extreme. So nou ewe skielik moet jy die persoon, want almal sê ek moet, in hierdie patroon vat. En dis hoekom hulle dit doen. In South Africa, there's probably only 1 or 2 groups that are pushing this and what I think is an unthinking gender affirmative process. In the majority of the places, the guys are being very careful about it, having true multidisciplinary groups. A lot of it's being run in state, understanding the complexities of the risks around it. And again, if you're an adult, you have the right to make your decisions. For me, the number one issue around here is around the kids. And in the article that we write, I make the argument that we should all be able to agree that protecting the child and the integrity of the child is the number one aim in that. And then understanding the limits of what we can do should drive this process. And this is why in Sweden, now in the UK and Finland, you can't do these interventions without the child being enrolled in a randomized controlled trial in controlled circumstances so that we can know what happens. Want as dit goed is vir almal, dan moet ons dit kan bewys en dan moet ons dit doen. Maar as dit probleme veroorsaak in die langtermyn, dan moet ons ophou daarmee. Maar the guys would say, no, we can't run a randomized controlled trial on it because if we do the randomized controlled trial, it will hurt the child. So they've already decided that this is the pathway. And the guys that do that are the Americans, because some of the Americans, because they don't have an overarching healthcare structure to which they are accountable. And some in South Africa are doing that because we have independent practice as an independent practitioner. In the state, you've got oversight. You're accountable to somebody. In Norway, Sweden, Finland, in France, in the NHS, now there's people looking at it. And when these institutions with accountability look at it, they say, whoa, you can't do this. It's unethical. We don't know the data. We need to put it in this framework. So ons kry hierdie samemeng in daai oorvleelingsproses.
Ek het blykbaar die laaste vraag vanaand en ek sal dit baie kort hou. Ek dink ons is baie keer geneig om aan te dink asof dit iets is wat in ander lande gebeur of Hollywood of op TikTok. Maar ek het nogals onlangs 'n artikel in 'n tydskrif gelees waarin ek geskok was. Hulle het met sielkundiges juis oor transgender issues gepraat in skole in Suid-Afrika. En 2 sielkundiges van Johannesburg het uitgewys dat die meeste van die kinders waarmee hulle op die oomblik werk, sit met transgender kwessies, issues. En jy het ook nou uitgewys dat jy self by skole praat, betrokke is, help om beleide en goed te skryf. So ek dink my vraag is, ek vra as 'n ouer, so my eerste vraag is, hoe hoog is hierdie verskynsel in Suid-Afrika op die oomblik? En hoe voorbereid moet ons as ouers wees om met ons kinders hieroor te praat?
So, net as in die Weskaap is daar omtrent 160 kinders onder die ouderdom van 18 wat transitioned is. In die 4 hoërskole waarmee ek betrokke was, is daar 2 tot 3 meisies, it's meestal meisieskole, that have transitioned or have, not surgically, but have said that they are transgender or identify as trans or binary, and at least around that 10 to 15 gender seeking. So in die Engelse skole en meestal in meisieskole, it is incredibly common. Van my interaksies met van die mense, vriende van my en so in van die Pretoria areas en die meer tradisionele skole, minder so, maar dit sal kom, without a doubt. So what I tell all headmasters and stuff is, this will come for you. Your kids are looking at it, they're watching it. If they're on TikTok, if they're on social media, they are seeing it all the time. They are being taught that gender is a fluid thing. And so when I go into puberty and I start feeling uncomfortable, the answer to that is I'm transgender. And so your kids will deal with this. And if they don't go through it themselves, they will have children around them that come out as transgender. So you must be dealing with issues. The schools need policies, clear policies that lay it out, and they need to be preemptive in it. Because the worst thing that you can do as a school or an academic institution is to respond on the fly. Your teachers need to know how we're going to respond to this. As a parent, you need to be understanding these issues. So with my kids, we'll drive down the road and I'll say, oh, there's a dog. There's actually a cat. Yeah, this hond. No, Dad. It'll assess. So if I say it's a dog, does it become a dog, Josh? No, Dad. So this is what ek doen op hierdie stadium. And we've already had to have some of the harder discussions around, at the age of 6 or 7, because of the things that are happening socially around them. One of my things is don't isolate, inoculate. Om julle kind te probeer isoleer van wat in die wêreld aangaan, it's a pipe dream. They will pretend to listen to you to high school, go to university, do what they want. You need to bring the arguments and the discussions into your household and have a discussion with the children and prime them and talk to them. Just in general about many of these things, but also going into this puberty thing, this is, I believe, a threat to their integrity, to their psychological integrity. And it is fueled by a misunderstanding of what is real. So I think bringing those things in and talking about them and being aggressive about it. And you need to control the amount of social media your child accesses before the age of 16. There are clear studies that show that girls' self-worth and self-image is drastically affected by Instagram because of what they see. It increases anxiety, it increases depression. If I sold a drug in the general environment that led to those type of side effects, I would be sued, knowing that those things are designed specifically to do that. But somehow we then allow that into it in an uncontrolled environment, and then, it's just technology. You need to be very thoughtful, careful, and controlled around that. And introducing it in needs to be done in a co-parenting way where you actually share an account. They need to know how to deal with sexual harassment online. When they get photos from people, randomly strangers, how do they deal with it? How do they respond to it? You need to be part of that parenting process. So ja, as julle dit nog nie gesien het nie, gaan julle dit sien. My big hope is that what's happening in Europe is they're starting to reap the consequences of what's been happened, and it's preceding us by about 10, 15 years. My hope is that we will be able to learn from the consequences there. And that also in our environment that we're in, we are not culturally the same broadly. I think we've got a different set of values, a different understanding. We're also very allergic in many ways to state intervention on us across the board. We don't want state to tell us what's going on. And so there's an inherent resistance, I think, in the cultural fabric of South Africa against being told what to do across all cultures, just because of our history. And so I think there's an element of protection in that. And then religiously, majority of people are Christian and much more all Muslim, Hindu, but they have a sense that this stuff is really true. And that foundational strength in it is a resistance to a lot of this ideology of nullism that you see in Europe. A very interesting dynamic that's there. So if you do the right things, the right training stuff, and then purposefully parent your child around this thing, knowing that it's coming, I think you start to prepare them for something like that. Dankie.